My name's Dr. Charlotte Tottman. I'm a clinical psychologist specialising in cancer-related distress, and I'm talking to you from the Adelaide Hills in South Australia. I'm a private practitioner and I work with people going through a cancer experience, their family members and carers at all stages of a cancer experience. So through diagnosis, treatment, post-treatment, and when facing mortality. The technical name for what I do is a psycho-oncologist, and a lot of people have never heard of that. And I'm here today to talk to you about whether I feel that self-care measures can aid in managing the side effects of AML chemotherapy and living with AML more generally. So the expected answer to that question is probably yes. And yes, I do feel like self-care measures can be helpful, but it's a little more complicated than that. And the reason I say that is because for anyone who's been through AML chemotherapy, you would understand that it is particularly rugged. It is a really tough gig. And I think it's really important to acknowledge that up front, because sometimes we can get a little bit enthusiastic about things like self-care, and that can be tricky because if we feel like, okay, I've got to do all this self-care stuff, but then actually it's almost impossible because of the treatment, that can make us feel like, you know, maybe there's something wrong with us, maybe we're failing, when actually it's the nature of the treatment itself. So I just kind of want to make that clear from the beginning, that I do really see and appreciate that chemotherapy can be brutal, and that self-care measures can definitely help. But also, if you don't feel like you're able to engage in self-care measures, if you feel like it's just about surviving the treatment, then that's a very reasonable mindset as well. The other thing that I want to highlight is that chemotherapy for AML can be delivered in two settings. Sometimes it can be delivered as an inpatient, so you're in hospital for a duration, and sometimes it can be delivered as an outpatient, where you're at home receiving treatment or going in and out of hospital. And the reason that I'm highlighting that is because often inpatient chemotherapy is more challenging to navigate in terms of side effects. It can be a tougher gig. And the second thing about being in hospital is that you're not in control. As the patient, you're not in control of the environment. So being able to exert influence and engage in self-care activities can be tricky, because you don't have necessarily access to the resources or the space to do the things that you might feel would be helpful for you. So I think it's really important to kind of acknowledge the context, and that if you're in hospital, it might be harder, the side effects might be more severe, and you're not in control of the environment. Whereas if you're at home, then it's possible that the side effects will be milder and you're in control of the environment. So self-care measures might be a bit easier. So the next thing that I want to highlight is that setting modest expectations in the self-care area in the context of AML is, I think, important, because if we set ourselves up with big self-care expectations, then again, the risk is that if we aren't able to engage in them effectively, that we feel like we're a failure, or we feel disappointed and frustrated. And that's kind of the opposite of what we're going for. So I'm all about small self-care measures. They're more doable and they're more likely to be successful. This is when I talk about the 4 pillars of coping. So when we're talking about self-care measures, I talk about it in terms of exercise, sleep, nutrition, and activities with purpose and meaning. So they're the 4 pillars of coping. And for some of us, one of those pillars might be more important than others. So for some people, if their sleep is out of control, then they're really going to struggle. For other people, if they don't move, if they're not mobile, if they're not getting some exercise or physical activity, then they really notice the struggle psychologically is harder. So sometimes working out which of those 4 pillars, sleep, exercise, nutrition, activities with purpose and meaning, which of those is the one that you feel like you need to spend the most time on, can be a good idea. But the other thing is to give a little bit of attention to all 4 of those. The reason that those 4 pillars help coping is because they sustain us. They, particularly exercise, sleep, and nutrition, they actually give us energy. Physiologically, they give us energy to be able to weather a really serious, if you like, health storm, like an AML experience and treatment. So concentrating on making sure that as much as possible, you are getting sleep, you are eating things that are good for you, and that you are doing something in the space of physical activity, even if it's just a short walk or sitting in a chair and moving your arms and legs. Focusing on those is going to help sustain you physiologically. It's also going to help you feel more robust and resilient psychologically. When we feel stronger physically, there's a very strong relationship to how we feel psychologically. We feel less vulnerable. We feel like we're more likely to survive this treatment. The other thing is that when we invest in self-care measures, we send messages back to ourselves. So self-care is kind of linked to hope and to confidence. If I'm investing in my own well-being, if I'm looking after myself, I'm sending myself a message that I'm going to be around. I'm going to survive this. I have a future. Whereas if I don't do those things, I'm more likely to feel hopeless. The other thing that the self-care measures do is that they increase what we call perceptions of control. So they make us feel more like we have some control in a situation that often feels really out of our control. And it can make life feel slightly less cancer-centric. So when we're going through something as big as a cancer experience, it can sort of start to feel like everything's about the cancer. When we engage in self-care measures, it can feel like we're diluting the cancer-centric nature of life, and we're actually bringing in some other parts to life. We can feel a bit less like this stuff is all happening to me, and a bit more like there's some stuff that I am doing myself. So I have some agency, I have some control. The other thing that self-care measures can do is that they can bring down the effect of things like cortisol and adrenaline. So cortisol and adrenaline are the chemicals that get released in our system when we are under high stress and when we are feeling a high level of anxiety. So when we engage in self-care measures, we can often bring down the impact of those cortisol and adrenaline impacts, and that makes us actually just feel better in ourselves. So in terms of what does all this self-care stuff look like? The thing about a cancer experience and about self-care measures is that it's very individual. And so what works for one person will not necessarily work for another. So some of this is a little bit of trial and error, and some of it's about reflecting on, what works for you, particularly in the space of activities with purpose and meaning. Activities with purpose and meaning are linked to our value set. And so they're about stuff that matters to us, that's important to us, and that fill up our cup. So for me, things like activities with purpose and meaning are things like, sounds a bit weird, but things like gardening. I get a lot out of gardening. It makes me feel really good. It links me with the earth. I'm out in the fresh air. It's a very sensory experience, and it really stills my mind and grounds me. Now, that's not going to work for everybody. Not everybody likes gardening. So it is about working out what are the things that kind of fill your cup. In terms of things like other self-care activities, I'll just give a few examples. It might be, and again, it's modest, it might be something like sitting outside in the fresh air or in the sunshine with a good friend or a family member, or maybe just with a good book. It might be something like doing some meditation or yoga. There are plenty of online resources that mean that you can do that in the comfort of your hospital room or your own home. And the thing about meditation and yoga activities is that they do tend to still the mind. They bring our arousal levels down, and that can help with resilience and navigating things like the side effects from treatment. The other thing that's really helpful is anything that's sensory. So we have 5 senses: what you can see, what you can smell, what you can taste, what you can hear, and what you can touch. And they're kind of underrated and underutilized. But anything that we do that ignites one of our senses has the effect of bringing us into the present. And if we're in the present, we aren't then ruminating about the past or worrying about the future. So being able to hold yourself in the present psychologically is incredibly healthy. It's really good for us, and most of us don't do enough of it. So things like music, or things that you can touch that feel really good to the touch. I'm aware that with AML treatment, sometimes it can really affect things like taste and smell. So that might be hard to do. But finding things that actually feel good and keep you in the present can be very helpful. There's one more thing I wanted to say, and that is the benefit of routine. So routine can feel like sometimes if there's too much routine, it can feel rigid. So when I talk about routine, I talk about routine with some flexibility. But the reason that routine is helpful is it gives life a framework. And again, it increases perceptions of control because it makes us feel a sense of predictability and order. And when we have that sense of predictability and order, we actually feel more secure. We feel safer. And that again plays into that resilience and being able to cope. And the one other thing that I wanted to mention is that as well as being able to engage in specific discrete activities of self-care in those 4 pillars of sleep, exercise, nutrition, and activities with purpose and meaning, there's also the benefit of sometimes setting boundaries and acknowledging the limits of what you're capable of doing. Setting boundaries is tricky, but it's essentially living life on your terms. And so that can mean about setting boundaries of who you'll spend time with or how much time that you will dedicate to relationships. It might be about how much you engage in things like work or caring or study commitments while you're going through treatment. And setting boundaries is about making sure that you're protected. And the second part of that is acknowledging the limits that come with something like an AML experience. It does often limit life for a period, and being able to acknowledge those limits and reset some of your expectations around what you actually can do is a really helpful thing to do. Because if we keep pushing as if we don't have AML, as if we're not going through that experience, as if we're living life as normal, then often that can work really, really badly for us. It can mean that we are under even more stress than the treatment itself is putting us under. So in summary, what I would say is definitely, yes, self-care measures can help navigate an AML experience, but I think expectations are really important. Taking account of the context is really important, and small is more doable and likely to be more successful. Thank you.